Everybody gets blood work at some time, just about. And a lot of people, I'd say the vast majority of the people, have no idea what the numbers mean. And so I wanted to do a talk where I could at least explain what the numbers mean and what some other tests that I think that are really important that some people should get, and at least make them aware of that. So when your physician orders a blood panel, he performs tests with two parts. You get a general chemistry panel, which measures organ function, minerals, serum lipids, complete blood count, which measures anemia and the immune system. And then there's other tests, and I order a lot of these other tests for greater specificity. So we're going to look at all of this today. So if we look at, I want to talk about normal and abnormal ranges. So the average or reference range, which you get on your blood work, represents values for the average non-hospitalized patient. As our society gets unhealthier, these ranges tend to get broader. So ranges outside of these values many times indicate a developing pathology, but you can have, blood work outside the clinical ranges and not have any symptoms at all. Ideal ranges, which are a lot tighter, which is what I use, represent how a body should function when it's working properly. Values outside these ranges usually indicate lower abnormal function, but not necessarily a disease process, pathology. So values outside of either range may or may not produce symptoms. So two other important aspects of blood work. Blood work represents what's being transported in the body, not necessarily what's happening in the tissue. Blood work usually represents what's happening in the body over a period of time. If you do like a hair analysis, something like that, then you get more of what's happening in the tissue rather than what's being transported. So let's look at electrolytes: sodium, potassium, and chloride. These elements are critical to cardiac, neurological, pH, and kidney function. When sodium gets really low, that's an adrenal dysfunction, or it could be insufficient fruit or vegetable consumption. So somebody comes into me, a normal sodium is like 140 to 144. Somebody comes in to me and they got a sodium of 135, 134, I immediately suspect that their adrenals are not working well. Okay. Elevated sodium and chloride usually indicates too much salt consumption. Now, what about somebody comes in with low potassium? Usually I see really low potassium on patients that are taking like some sort of pharmaceutical, like a blood hydrothiochloride blood pressure medication that's forcing minerals out of the body. And when sodium or potassium gets too low, that can cause cardiac issues because your heart depends on normal sodium and normal potassium. So if somebody comes in with really low potassium, I'll ask what drugs they're taking. We want to find that out, and then I want to give them some products that will help elevate their potassium and have them eat foods that are higher in potassium. So here we go. Elevated potassium. When potassium goes up, it's low adrenal function, adrenal fatigue, could be dehydration, or tissue destruction. We have to correlate that with other tests. Low potassium, drug diuretics, adrenal hyperfunction. And we're not talking about super low potassium for adrenal hyperfunction, but normal potassium is 4.0 to 4.6. They come in with like a 3.7. Your adrenals are really stressed. Fatigued heart muscle, diets high in refined carbohydrates will shove the potassium down. There's a good scientific biochemical reason for that. The body's trying to not to get too acidic, so it uses potassium to neutralize too much acid in the system. So blood urea nitrogen and creatinine. Blood urea nitrogen is an indicator of kidney function. So elevated BUN usually indicates kidney dysfunction or dehydration. The BUN is low, that's a lot of times either low pituitary function or a lack of protein in the diet. Creatinine reflects prostate or urinary tract function, also muscle metabolism. So if somebody comes into me and I draw their blood and comes back with a really high creatinine, but they just worked out, did a heavy workout the day before they came in, that's probably what it is. It's muscle breakdown. So if they're an older guy, not necessarily even older, but a guy that comes in, they haven't worked out a lot and their creatinine is high, usually they got some prostate inflammation. That's usually what that means. Total protein. Total protein is really important because it represents your body's ability to digest and absorb protein effectively. Extremely high protein levels can indicate disease because the body's actually breaking itself down and breaking down its own protein. And that's being spilled over into the blood. A dropping or low albumin usually represents a poor state of health or developing disease. We'll talk about that in just a minute. Albumin globulin ratio. This is really an important part of the testing that I do. An albumin globulin ratio should be about 1.2 to about 1.8 in that range. When it's really low, like 0.7, you've got a serious issue going on in the body. It doesn't tell you what. So here's something that happened with my mother. Like several years ago, I flew out and to drop everything and fly out and go see her because she was in the hospital, and we thought, she's going to pass away. And so I saw her blood work, and her albumin globulin ratio was 0.5. That was serious. That's like she was sick, okay? But she recovered, and now her AG ratio is fine. It's normal, okay? So I learned something very important from that. I learned that when people are sick, their albumin globulin ratio will go down, but that doesn't necessarily mean they're going to die, I used to think, man, somebody comes into me with an AG ratio of 0.6 or 7, they need to be told they need to be warned, well, it is not good, but if they're up walking around with an AG ratio of 0.7, there's something going on inside of them that's not good. But that doesn't necessarily mean they're going to die. Elevated AG ratio, dehydration or immune dysfunction, depending on how high it is. Glucose and hemoglobin A1C, how well is the body handling carbohydrates? Fasting glucose, I look at after a 12-hour fast. Hemoglobin A1C is the average blood sugar over a 3 to 4 month period. And low or high sugar levels reflect mineral deficiencies and dietary excesses. I rarely see low. I don't think I've ever seen an A1C that was too low. I rarely see low blood sugar. It's always high. So it reflects how well does the body metabolize carbohydrates. Insulin, which is one of my favorite tests. Elevated insulin levels linked to diabetes, cancer, obesity, insulin resistance, and insulin locks fat into the cells and makes weight loss difficult. Insulin should be below 5. okay? That's the ideal insulin, below 5. Calcium and phosphorus. These values indicate your body's supply of calcium. Really low calcium indicates that your body is not absorbing calcium very well from your food, and that you could be developing osteopenia and osteoporosis. Phosphorus reflects vitamin D levels. If the calcium is really high, a normal calcium is like 9.3 to about 10.5, I think, 10.4. If somebody comes in to me and they got a calcium of 12, you know, I would probably send them to a physician, say, I think you should get a bone scan and see if you've got anything, disease process going on in your bone that's causing your bone to disintegrate and dump calcium into your blood. So rarely have I ever seen that. But really high levels of calcium or really low levels of calcium are both red flags. Magnesium. Magnesium is really, really important. It activates over 300 metabolic enzymes, controls the hormones which direct calcium into bone and joints. Adequate magnesium decreases the body's need for calcium. Deficiencies in magnesium can lead to heart problems, high blood pressure, cramping, serious muscle cramps at night, and many other symptoms. And there's, when the things that I read say that probably the majority of Americans, over 50%, are magnesium deficient. Doesn't surprise me considering the way people eat. So magnesium, a high refined carbohydrate diet depletes magnesium. Cholesterol, triglycerides, and blood lipids. Excuse me. You're familiar with this. They can reflect carbohydrate metabolism. Low cholesterol is a hormone, indicates there's going to be a hormone insufficiency. Your hormones are made of cholesterol. Continually dropping cholesterol. Cholesterol just drops, then it drops, and then it drops. Bad news. Very bad news. Very ominous. Triglycerides are reflective of diet. So if somebody comes into me and they have high triglycerides, triglycerides should be about like 85 to 115. They come into me with triglycerides of 160, 170. I don't care what they tell me about their diet. They're eating too much sugar, okay? Too many refined carbohydrates. So triglycerides are when they're really high, that's really stressful on the heart. Your blood gets real sticky. So you need to keep your triglycerides down. Alkaline phos, SGOT, SGPT, GGT, these are liver enzymes. And depending on whether they're high or low in certain combinations, it can indicate liver toxicity, fatty liver, pancreatitis, B6 zinc or magnesium deficiency, or cellular destruction. So a high GGT indicates to me the body lacks glutathione, which is the most important antioxidant and detoxifier in the body. So somebody has a really high GGT, they always get N-acetylcysteine from me, NAC, which raises glutathione levels. And they'll get probably another supplement for the liver as well. Alkaline phos. Elevated alkaline phos is either liver toxicity or bone destruction. And you can look at some of the other parts of the blood panel and figure that out, which one it is. Low alkaline phos is almost always a zinc deficiency, but possible B6. LDH, another marker that I really like. LDH, I'm just going to tell you, this is called the poor man's cancer marker, okay? So an elevated LDH is pretty high, shows that mitochondria are not functioning well. Low mitochondria are associated with cancer. Low mitochondrial function is associated with cancer. It can indicate tissue inflammation and destruction, liver gallbladder dysfunction. You can fractionate out the LDH and LDH isoenzymes, which can give you a much better indicator of what organ is being affected. But somebody comes in to me with an elevated LDH, they got issues. I'm going to talk about this more in just a minute. So low LDH could be dehydration, low stomach acid, dysbiosis, excessive protein intake, pituitary issues, adrenal issues. It depends on what the other markers say. All right, so, and I don't see a lot of people with an LDH that's really low. Most of the time it's high if there's a problem. Red blood cell, hemoglobin, hematocrit, these are your iron values, how well your body's utilizing, absorbing iron. Low values, anemia. High values indicate too much iron. Low transferrin can indicate liver dysfunction. Transferrin is an iron storage protein. It's a very sensitive marker of iron in the body. Too much ferritin, excuse me, I'm not talking about ferritin here, am I? No, we'll do that another time. Okay. Transferrin, by the way, are the trucks that move the iron around in the body. So if the transferrin is low because it's made in the liver, then you have liver dysfunction. Doesn't matter what the other liver enzymes say. Low transferrin, liver problems, so you treat the liver. The M's, MCV, MCH, MCHC, when they're low, you got anemia. When they're too high, you have a B12 folate deficiency. Okay, that's what that means. Neutrophils, lymphocytes, monocytes, EOs, basos, white blood cell. This is your immune system. So low neutrophils and elevated lymphocytes, it's either chronic food intolerances or a viral infection. Again, depending on the patient's symptoms, depending on other markers. Elevated neutrophils and low lymphs, that's usually a bacterial infection, especially with an elevated white count. So, this whole thing, the CBC with differential, it tells me what's going on with your immune system. If you have both elevated eosinophils and monocytes, that's parasite, usually parasites. And elevated eosinophils by themselves usually can either indicate food or environment or allergy, but I think somebody that comes in with elevated EOs, they've got gut inflammation. And I'm probably thinking that they've got leaky gut when their eosinophils are high. Basophils, elevated basophils, allergy, toxicity, or infection. And you can kind of figure that out from the other markers. You're just talking to the patient and asking them about symptoms, what they've been exposed to. Vitamin D. Vitamin D is one of your most powerful immunomodulating hormones. Vitamin D is not a vitamin, it's a hormone. It looks a lot like your other hormones, like it's made from cholesterol, just like testosterone and estrogen. It's really important for absorbing calcium, and it has a lot to do with people's moods. It affects our brain function and the way we feel. And by the way, I find patients with really low vitamin D. Occasionally I find patients with vitamin D that's just way too high, and I say, you just need to back off, you're taking too much. But I see a lot of people, low vitamin D. ESR, erythrocyte sedimentation rate. I don't use this test very much, but it determines the level of tissue destruction, inflammation, and it's an indication that the disease process is ongoing and should be investigated. HSCRP, I use this all the time. Excuse me. It's an inflammation test, basically. When it's high, you're inflamed. That's that simple. Now, this is an interesting concept right here. This is something that very few people know or understand. The LDH, the HSCRP, and the ESR are coined the trifecta, okay? When all three of those tests are high, you have a greater than normal risk of getting cancer and can be an indicator of prognosis. So one of the ways that you can find out if somebody's cancer is getting better is do these three tests. They're really cheap, they're not expensive, and you can do those three tests, and if they're elevated and they stay elevated or they're getting higher, then my take would be you're not getting that much better. You're not getting better at all, actually. When they start going down, that's an indicator that the body is getting better. Okay, so these are really good tests just to monitor disease. Okay, and like I said, they're easy to do, they're cheap. You do them with just a couple of tubes of blood, and they really help you understand what's going on in the body. And if somebody comes in, and this is what bothers me a lot. Okay, but because I'm not a cancer doctor, I can't really speak with authority to my patients on this, so I've just given up trying. If somebody comes into me and they say, yeah, I had an MRI scan, the scan was clear, they said I don't have cancer. What I would want to do is say, okay, let's look at these three tests and let's see where they're at. Let's see how high they are. And if they're really high, I would just say maybe you should do some other things as well, because you got to get those down, okay? Let's look at thyroid tests. TSH. TSH is not a thyroid test. It is a pituitary hormone, and it represents the response of the thyroid gland to produce T4. So T4 and T3 are the amount of active thyroid hormone being produced by the thyroid and converted in the tissues. These two markers tell me, do you have an autoimmune thyroid disease? So if somebody comes into me and with their blood work, and they have a TSH, which should be like 0.5 to 2, and their TSH is 5 or 5.5, automatically I want to do these tests because I suspect they might have an autoimmune disease and not even know it. And I've seen it a lot. Okay, then I know they have a gut issue, and we have a whole series of things we need to do. But TSH is not a good test to tell me what, I see this all the time. Somebody comes in, elevated TSH, they got the test from their doctor, doctor says, yeah, we got to put you on thyroid hormone. They have no idea what's causing it. They don't even look for it. They don't even look for the cause. They just say, yep, you got to take levothyroxine. To me, that's just stupidity, okay? We need to find out what is going on with the thyroid. What's causing the TSH to go up? Unless you find that out, you're just shooting in the dark. That's, to me, is ridiculous. TMAO. This is another great test. I don't do it a lot. Very, very good test, though. Trimethylamine N oxide. It's a toxic compound produced by human gut bacteria in response to basically red meat, okay? So TMAO is an indicator that can predict risk for heart attack, stroke, metabolic syndrome, kidney disease, and death. So when TMAO is high, that tells me, let's see what my next slide is. You've got intestinal dysbiosis. So it's like a poor man's gut function test. and it predicts heart issues, okay? And so why is this information important? Because it demonstrates the relationship between gut dysbiosis and cardiovascular disease. So how many of you ever heard that eating red meat's bad for the heart? That is bull crap, okay? So it's not bad for the heart. It's only bad for the heart if you have dysbiosis, because gut dysbiosis acts on the protein, on some of the amino acids in the red meat, which produces TMAO. The problem is not the red meat, it's the gut dysbiosis. So that's the thing that has to be fixed. TMAO is a really good test. It's not cheap. It's like $165 for that one test, which is about close to half of what my Bloodwork is for when I'm putting it on sale. But it's a very, very useful test. And I do it on some patients. Homocysteine. This is the last test we're going to look at. Great test. Homocysteine is a sulfur-containing amino acid that's naturally present in the body. Okay, it's an intermediate product in the metabolism of methionine, which is a sulfur-containing amino acid. You get this from protein. Low levels of B vitamins can lead to elevated homocysteine, B6, B12, or folate. Now, why is homocysteine important? Elevated homocysteine can damage blood vessels and increase the risk of atherosclerosis, heart attacks, and strokes. Elevated homocysteine has been linked to dementia, Alzheimer's, and other cognitive impairments. Increased levels can lead to preeclampsia, recurrent pregnancy loss, and congenital defects. I see elevated homocysteine all the time. I've got it, okay? I work on that. I'm lowering mine. I think some people don't absorb folate and B12 as well. I think I'm one of those people. So that tends to elevate homocysteine levels. So homocysteine is a great marker, much better marker for heart disease and cholesterol, as is TMAO, much better marker than for heart disease than is cholesterol. So those are the markers that I use in my office. Do you have any questions about anything I've gone over?
What's anemia?
Anemia is when you have low iron in your blood. So I'm going to go over your blood panel right now. We're going to go over it step by step here. So the first test that's on this first page is insulin. Your insulin is 7. It's not bad. I'd like to see it a little lower, but I don't freak out if I see a 7 insulin. I mean, the worst insulin I've ever seen was 73. So 7 is not the worst I've ever seen. Okay. However, when we drop down and look at your fasting glucose at 183, that's pretty high. It's really high blood sugar. So that you need to really work on. Now the urea nitrogen is 20. You probably have a little dehydration there. I wouldn't call that kidney dysfunction, but if you go down and look at your serum protein, it's really low at 5.9. So your body is taking the protein that it has and it's metabolizing it okay because your urea nitrogen is normal and your calcium is 9.5, which is good. So that means your body has the capacity to absorb protein. So Don, what I suspect is this could be coming from the treatment that you've had for some of the problems, health issues that you've had, or it could be from some of the pharmaceuticals you take. That's why I think this is so strange. I think it would be worse if you weren't taking you're taking that powdered amino supplement that I have. I think it'd probably be worse if you weren't taking that. It'd be really nice to be able to get that up. So one suggestion that I would give to you, and I don't know if I've said this to you before, is get some bitters. You can get it like at Trader Joe's or liquor store and put it in some water before you eat and drink the water down. That'll help you digest food a little bit better. And it's cheap you know, bitters are not expensive. We use them at home. So you could do that. That might help. Your globulin is 1.5, which is really low. So globulin, as we said earlier, is part of your immune system, your immunoglobulins. So your immune system is really compromised. And you don't really seem to have the protein that your body can't absorb and utilize enough protein to build it up. So that's something you need to work on. So I would try the bitters. The next page, the first test we come to is hemoglobin A1C, 7.2. That's pretty high. Should not be any higher than, the reference range is less than 5.7. That's pretty close to the ideal range too. The ideal range would probably be 5.5. 7.2 is high, so you need to work on that.
What?
I was telling him mine's worse than that, so
Oh,
he's doing
okay.
good.
All right. Working on yours too, Randy. He's got to
Me
behave yourself.
and my big mouth.
Okay,
Would
now
you mind repeating that? The hemoglobin, what?
A1C.
Yeah. Needs to be down below 7 at least.
It should be below 5.7.
Okay.
And that's if you can get it down below that, you're doing well. So the next thing, we're looking at your immune system here. Your white count is really low at 3.4, and that's reflection of your immunoglobulin, which is low. So your immune system is compromised. Now, here's another thing that I'm seeing here is red blood count, hemoglobin, hematocrit, all low. So you've got anemia, but I don't know, I don't have an iron panel, so I don't know what to tell you about it. Like if I had like iron and ferritin, those two things, I could tell you exactly what was going on. But I don't know from this what's really happening. Do you need ferritin? Is your, where's your iron levels? Where are your ferritin levels at? So that would be a good thing to get, like an iron panel with ferritin, so you can figure out what you need, because anemia is a big deal. When your body's anemic, that's like a red flag. That's like, you need to do something about that. But I don't know what you need to do because I don't have enough information. Now your MC.
Did you provide that test?
Yeah, we can do that.
Okay.
Yeah, it's a simple blood test. It's a non-fasting blood test, actually. MCV, MCH are high, so you probably need some B12 and folic acid. Your platelets are low, which probably is reflective of the anemia and the low folic acid and B12.
The platelets were what showed up when they diagnosed my lymphoma.
They were really, really low.
At 8. Had to have a transfusion to keep from bleeding to death if I cut myself shaving.
Well, I would think that's a good idea, Don.
Wow.
8 is a medical emergency, for sure. Yeah, so if you're at 133, then you're doing pretty good if they were 8.
The last time it was 150, so it was...
Yeah, 150 is adequate. Yeah, that's good. Neutrophils. Your neutrophils are low at 48. Your lymphocytes are normal though, which are really good. I think they were 36. Yeah. So the low neutrophils again represents low white count. So you just trying to get more protein into your body, to get your body to utilize protein would help bring that up. That you really have a protein deficit, and again, it could be the pharmaceuticals you're taking. I don't know, but your body's, at least it's using what it has, it's absorbing and using what it can. Monocytes are really high. So your lymphocytes are normal, monocytes are high, which means that you know, they're constantly trying to clean up things. It's usually indicator of a high monocytes or an ongoing infection, but you know, like your blood work is so crazy because it doesn't look like you have an infection because your neutrophils are low, your white count is low, but your monocytes are high. So again, this makes me wonder if it's the, you know, pharmaceuticals that you're taking. And the last thing that we're going to look at is vitamin D. Your vitamin D is 46. That's not bad. It's not terrible. I wouldn't get real upset about that at all. I like to see it a little higher, maybe up to 50, but somebody with a 46 vitamin D that's not that bad. So I wouldn't worry too much about that.
When I first came in to see you, my vitamin D was excessive, and you pointed that out, and so you had me cut back on my.
Yeah, it's over 100, right?
Yeah, I don't recall, but it was way high.
Yeah.
So you said, don't take it anymore.
Yeah, right. Yeah, because you don't want to poison yourself with vitamin D. So some people have done that. So vitamin D, you can take it. You can start taking it again.
Okay.
It's fine. Yeah. So that's what I'm finding on your blood work.
So how do you find out if pharmaceuticals are causing some of his problems then?
Well, because there's certain patterns of blood work that I've looked at thousands and thousands of blood panels, and his patterns are just so crazy. You don't see patterns like that.
Right. Okay.
So it has to be something that's causing that.
Right.
You know, and I know his history. You know, he's had a history of some serious metabolic issues. And because of that, and I know that he's taking some pharmaceuticals and has taken some pretty heavy duty ones for a while. And so makes me wonder if that's what's causing that, you know.
So wouldn't the doctor want to adjust then appropriately then? If they pinpoint that it's his pharmaceuticals that are making this go haywire, wouldn't the doctor want to, you know, how do you adjust all that?
I don't know, because I don't prescribe pharmaceuticals. I don't prescribe that stuff. So I don't know how to work with it.
Because you've made a reference 3 times to it. So
Right,
that could be a concern.
Yeah, so I'm thinking that's probably what it is. And, you know, I have no idea what to do about it.
So what question should I ask when I meet with him on Thursday?
You could say, you know, there's a lot of things about my blood work that are pretty screwy. Are the pharmaceuticals you're giving me causing that? I mean, you could just ask him that
There
right
you go.
now. You know, why is my, panel with ferritin? We could find that out easy. Yeah.
I mean, they were prescribed, those pharmaceuticals were prescribed to you to heal you. I mean, that's the bottom line,
Well,
is healing.
it may have saved his life. That's the thing. It's like, because you come in with a platelet level of what, 8?
Yeah.
I mean, and I don't like drugs, but they do save people's lives, you know, and I'm not going to bash that. So,
Right.
but I see what they do, you know, in other aspects of health, and I'm not too, you know, happy about that. So,
Well, they overprescribe.
some doctors certainly do.
Yeah.
Some, yeah. So I'm not saying his does, but some do. Yeah, for sure.
Don't you think sometimes there's just no follow-up and you just keep taking it until there's a problem?
Yep. And I said this before, I'll say it again. When you're on, and Carmen's ready to go, and then this is going to be the last thing I'm going to say. Okay, when you take prescription drugs, they leach vital nutrients out of your body, vitamins and minerals, and it's like a drip, drip, drip. So it doesn't matter whether it's over the counter, whether it's prescription, they leach essential nutrients out of your body. And that's something that you need to know. I don't know if physicians realize that or not, but it happens. And so over time, that can cause side effects and symptoms. So thank you for being here tonight. Appreciate it. Our next talk is in about 3 weeks.
On lifetime care.
Lifetime care.
Yeah.
Give Carmen a break. She just loves being here on Tuesday nights. So